where bone marrow transplantation meets CAR-T cell therapy was one of the topics that we addressed during the Patient, Family and Donors Day. And this was quite relevant because there are still patients that may have experienced one or the other or the two of them. And it is true that by the time CAR-T cell therapies were adopted into clinical practice, we were not sure about some management strategies, especially of the adverse effects, neither how the patient trajectory was going to look like. And we needed to find a place where to look at, to try to bring those learnings to speed up, to come to a better management for the patients. And the only possible way to look at was the bone marrow transplantation. All the learnings that have been achieved during a number of years in that setting has been massive importance for the CAR-T landscape, in the sense that the trajectory of the patients is a bit similar. It's not the same, but it's a bit similar. But it's quite interesting when you start to come into details for the comparison, for instance, how the toxicities are experienced by the patients. When you have in the bone marrow transplantation, for instance, in the allogenic, the risk, let's say, of developing graft-versus-host disease. That's not the case in the CAR-T cell therapy. However, with a CAR-T cell therapy, you may have cytokine release syndrome. You may have much more neurotoxicity. And we needed to understand also the differences between them. And what I think is beautiful is that learning from CAR-T is also helping to improve, that's my personal opinion, it's helping to improve also the clinical practice of bone marrow transplantation. At the end, many of the hospitals that are delivering CAR-T today have been delivering bone marrow transplantation by a number of years. And the clinicians, the medical teams, the multidisciplinary teams are almost the same. However, when we look at details for the patients, the criteria for getting access to CAR-T cell therapy have expanded the options for the patients, because when bone marrow transplantation have a more narrow criteria, for instance, for older patients, CAR-T has been possible in many patients with older that may not have the bone marrow transplantation option. So it was quite an interesting dialogue about where they have divergences, but also when they come together, what we can take from that, the similarities to help to improve the patient outcomes, to help to improve the management, the supportive care for the patients as well, and for the caregivers, because the role of the caregiver looks also a bit different in the two sides. What I want to stress is that in one versus the other, the problems from the patient's perspective look pretty much the same when it comes to analyze patient information. For instance, the needs to improve the communication, the information that is given to the patients early on the trajectory of the treatment, how you need to prepare them psychologically for what they are going to live next, how you need to prepare the caregivers, how to anticipate potential risk or potential adverse effects that they may experience on a late setting once they are discharged from the hospital.